Hello everyone and welcome to another lecture. Today we're going to be discussing OSCEs, Objective Structured Clinical Examination. So stay tuned. Now if you're planning to take an OSCE, especially if you're applying for registration in the UK as an IMG, you're going to have to take PLAB 2. Now to get GMC registration, you're going to have to pass PLAB 2. Now OSCEs are generally a simulation of clinical scenarios, whether it's managing a patient, taking history, discussing something with a patient or a colleague, undertaking a procedure. OSCEs are widely used in formative assessment or summative assessment. Usually, when we're using OSCEs in formative assessment, we're going to provide some form of feedback to give candidates an idea of where they can improve their performance. Summative assessment, on the other hand, is about reaching the mark, reaching the passing score, like in PLAB or in final year, trying to assess clinical competences. Now, if we're thinking about a clinical scenario, I'm going to tell you the layout of the approach that we're going to use. This will be helpful for PLAB especially, if you're planning to do it. PLAB 2 assess 3 domains: data gathering, management, and interpersonal skills. Now, data gathering is all about history taking. Whether you're performing a physical examination, you're undertaking a procedure, or you have to list investigations you want to perform. If you're thinking about management, they're going to be assessing whether you know the diagnosis, you're able to explain the diagnosis to the patient, or explain something else, and you're able to create a management plan for your patient. If we think about interpersonal skills, we're going to think about rapport, building a rapport with your patient, how you use open and close questions. Also, they're going to be assessing whether you involve the patient or not, if you're acting with professionalism, and if you're taking into consideration any ethical issues. Try to finish your OSCEs, or train yourself to finish them, within 5 to 8 minutes, a mean of 6 minutes. First, you're going to read your task. You need to make sure you understand what you've been asked for. You need to take history, you need to perform physical examination, or you need to do something else. Discuss with the patient, break bad news, or speak to a colleague and give them feedback. Make sure you know this. Now, once you know the task, let's talk about a clinical scenario. So in this case, we're just going to take history. So we're going to think about a couple of things to do. We need to think about the approach we're going to do. We're going to greet the patient, introduce yourself, confirm identity of the patient, and gain consent. Once we've done this, we can move on and start off with all the parts of history taken. We're going to think about P3/maftosa. It's well known, and you're going to like it. I was going to think about ICE and management plan. Now, P3/maftosa, let's concentrate on the P3. We're going to list presenting complaint, past medical history, and personal history. Now, if we're thinking about presenting complaint, there's a couple things that we should ask ourselves. Is this patient complaining of pain or something else? If the patient is complaining of pain, let's think about Socrates. If not, we think about Oedipara. Now, when we say Socrates, let's remember what each letter means. So, site, onset, characteristics, radiation, associated features, time, exacerbating or attenuating factors, and severity. Body power, on the other hand, we need to ask about the onset, duration, progression of the disease, aggravating factors, relieving factors, and associated symptoms. In terms of past medical history, I always ask about surgical and medical history. Think about trauma as well. In personal history, ask about sexual life, recreational drugs, menstrual cycle. Take history about systemic review. Let's ask general questions about cardiovascular, respiratory system, alimentary system, urinary system, central nervous system or peripheral nervous system, skin, locomotor system, endocrine system, ENT, and eyes. Let's go through maftosa. M's going to send for medication. Let's ask about all the medication, current or past medication, any allergies, any family history that could be relevant, medical conditions running in the family maybe, travel history. This has been quite relevant nowadays with COVID-19. Occupational history. They retire. What do they do for a living now? Social history. Do they drink, smoke, anyone at home, or anything else? Then we're going to focus on eyes, ideas, concerns, and expectations. It's really important for us to make sure that our patient's feeling okay. So ask them, do you have any idea what is going on with you? They might give you an answer. It's going to help you with diagnosis, believe it or not. And ask about consent. Any pets at home, family, or work? Any expectation, what are they hoping to get out of this consultation? Any requirements that they might have? We're always going to check for two things. First of all, that you have all the information and that you understand the information. So summarize everything the patient has told you. And check for understanding from the patient. Does the patient understand where we're at? Now we're going to move on to management. Management, they might ask you, they might expect from you to list investigations to reach a diagnosis, and then to make up a management plan. Always think about three differential diagnoses. When you think about management plan, think about medical, surgical, or non-medical plan. Especially need a package of care, such as service to be involved or something else. I would think about three differential diagnoses and why you think they are the most possible causes for the presenting complaint of the patient, and what investigations you would do to reach those diagnoses. That's it for now, so thank you for watching, subscribe to my YouTube channel and follow me on Facebook.